So let us discuss about carpal tunnel syndrome today. Now before we do that, let us discuss what is carpal tunnel. So carpal tunnel is a little tunnel which protects one of the nerves of the hand called the median nerve, which passes through the wrist under this tunnel called the carpal tunnel, which is a fibrous band essentially protecting the nerve. And then the nerve goes and supplies some of the fingers of the hand. Now, as I said, typically the carpal tunnel protects that nerve from injury from outside. So there could be trauma, there could be repeated hand movements like this during cooking, for example, and the nerve is protected. But sometimes in some diseases or in some individuals, this fibrous band called the carpal tunnel actually presses on the nerve. And under those circumstances, the nerve gets irritated and it can give rise to symptoms like pain, like tingling of the fingers of the hands here, or numbness. And that is called carpal tunnel syndrome. The worst time to suffer from carpal tunnel syndrome typically is in the early hours of the morning. People can say that we wake up with a pain, and once we shake the hands like this, the pain goes away or the tingling goes away. Who suffers from carpal tunnel syndrome? The typical age, if you want to know, is women typically of the middle age. It doesn't exclude other ages, it doesn't exclude men, but that is the commonest. It happens in people who are overweight, it happens in people who are pregnant, it happens in diabetes patients, in those who have thyroid, in those who have rheumatoid arthritis, and so on and so. I told you about the symptoms of carpal tunnel. Now I'll tell you how to test carpal tunnel. The typical commonest test is called a nerve conduction test, where you do small electrical stimulation of the nerve there and you look at the conduction of the nerve. Is it normal or is it slow? In carpal tunnel syndrome, the conduction of the nerve is slow, and that's how we know the patient has this problem. It can be mild, and simple painkillers can help. Or it can be severe, in which case you might require a little release operation of that nerve. It's very simple, it's typically done under local anesthesia, doesn't take much time. But whatever it is, I think if you suffer from these symptoms of carpal tunnel syndrome, the best thing to do is to approach your doctor, who will sort it out for you and arrange treatment. It's not a serious disease, it is eminently treatable. And you should not keep it waiting.